Private practitioners should coordinate with hospital medical staffs to see if they should help at the hospital or keep private practice open. Use phone triage with regular patients calling. Consider providing educational material for your patients, emphasizing prevention methods before an outbreak. Emphasize prevention. Planners within your organization should recognize the preeminent value of prevention. This is particularly true for infectious diseases, where a focus on prevention of transmission is critical to minimizing the burden of disease. Clarify the process for leadership and coordination. It is critical to identify leaders, alternates, and the decision-making process for resource allocation and policy guidance. Identify existing national and state tools, protocols, and processes. Many resources have been developed to help plan for catastrophic events such as an influenza pandemic. Montgomery County has prepared a pandemic influenza readiness video for the general public. Obtain a copy of this video and hold an information session with your staff so they will know how to prepare on a personal level. The following websites provide reliable, accurate, and timely information about pandemics. pandemicflu.gov, the World Health Organization, WHO.int, Centers of Disease Control, cdc.gov/flu, Federal Emergency Management Agency, FEMA.gov, Pennsylvania Emergency Management Agency, pema.state.pa.us, Montgomery County Department of Public Safety, dps.montcopa.org, and Montgomery County Department of Health, health.montcopa.org. Consider the legal and ethical issues related to planning and responding to an influenza pandemic crisis. Planners must be familiar with state emergency powers and have a solid understanding of what types of events or circumstances would trigger their implementation. Planners must also be familiar with the ethical principles that underlie decision-making for the allocation of scarce resources. Consider vulnerable populations. Explicit planning must occur at all levels for vulnerable populations, including infants, children, the frail elderly, pregnant women, the disabled, the mentally ill, and special needs groups with chronic medical conditions such as cardiac, dialysis, oncology, and HIV patients. Without explicit and specific planning, the needs of these populations may not be adequately met. Develop robust security plans. Security is especially important in the case of a large-scale mass casualty event triggered by an influenza pandemic because of the chaos and confusion surrounding a pandemic event. Having a uniformed presence such as hospital security personnel, police officers, National Guard, and volunteers will help to maintain order, as will identification tags, visiting rules, and procedures for accessing supplies, service sites, and patients. Contact your local police department now to discuss a plan to safely and efficiently secure critical medical facilities.
Optimal allocation of scarce resources during an influenza pandemic is more likely to occur only with proper advanced planning at the healthcare system, community, county, state, and federal levels. For hospitals and other healthcare organizations, the following are some questions and activities your organization should consider when preparing your key pandemic readiness strategies. You can find checklists with additional guidelines on the website www.pandemicflu.gov. Has a planning committee been created to specifically address pandemic influenza preparedness and incorporate it into your organization's existing emergency management plan? Have key roles and point of contact personnel been identified? Obtain copies of available community and state pandemic plans, in addition to the Department of Health and Human Services Pandemic Influenza Plan, to use when developing your organization's own written plan. Assign a team member to be responsible for monitoring national and state public health advisories. Create a surveillance plan to track illness trends. This will ensure that your organization can detect stressors that may affect operating capacity. Has a communication plan been developed? Is there a plan in place to provide education and training on influenza pandemic issues to ensure that all personnel understand the implications of and control measures for those involved in handling an influenza pandemic? Develop a plan for triage and management of patients during an influenza pandemic. Does the infection control plan address the access to personal protective equipment? Does your occupational health plan address issues such as sick leave policies, vaccination of personnel, and antiviral use? Does your emergency management plan address surge capacity during an influenza pandemic? Do you test your state 800 and county 800 megahertz radios at least monthly? Do your personnel know how to receive and respond to the County State Facilities Resource Emergency Database, FRED, system alerts from the internet to your email and text devices? Have you practiced your Facility Emergency Operations Center plan and coordinated with the local and county emergency management coordinators? Contingency staffing plans should be developed in collaboration with other local emergency first responders and public safety officials. Has a facility access plan been developed which includes criteria and protocol for limiting visitors and closing facilities to new admissions? Have informational materials for patients on influenza pandemic that are language and reading level appropriate for various populations been identified and procured? Have anticipated durable and consumable resource needs been determined? Has a strategy for handling increased numbers of deceased persons been developed? Individual health care providers should be educated about the following: personal hygiene, including hand washing and use of hand sanitizers, and social distancing. Every medical and healthcare professional organization in Montgomery County will need to plan ahead to address how a pandemic might affect their organization and what actions will need to be taken before, during, and after a pandemic occurs.
Public health officials worldwide have been preparing for a pandemic flu for several years now. Montgomery County has a pandemic flu response plan that addresses the actions to be taken to prepare for a pandemic, as well as the actions to take to respond to one. Although a pandemic flu would present many challenges for our staff, our students, community, and healthcare system, the goal of our plan is to minimize the impacts of pandemic disease on all of us. Remember, the most important thing we can do is to make preparedness a way of life.